Now, live with Greg Olson, Director of the New York State Office for the Aging.
Well, good afternoon, everybody. My name is Greg Olson. I'm Director of the New York State Office for Aging. If you saw that intro as being new, it is. And I want to thank Alex Hyatt for pulling that together. Much appreciated. So I don't know if you know this. I certainly didn't, but it is CROPtober. And what CROPtober is refers to the peak autumn season when outdoor cannabis crops are harvested, dried, and processed. Did you know that adults 21 and over in New York can now cultivate cannabis at home? This includes medical cannabis, the topic of today's show. And you'll remember you might remember we did this last year, the benefits of cannabis on older adults, and surprisingly was extraordinarily popular. We had 142,000 views in a 2-week period. So we'll talk a little bit about home cultivation, including what's legal and what's not, and of course, reiterate the benefits of cannabis. Just by way of background, in 2016, New York State implemented the medical cannabis program. And in March 2021, the Marijuana Regulation and Taxation Act amended the program and improved access for medical patients. This included expansion of qualifying medical conditions, an increase in the number of caregivers a patient may designate, and the expansion of available product categories and dispensing limits. Over the last 7 years, the medical program has allowed thousands of New Yorkers to gain access to safe, lab-tested medical cannabis treatment and has laid the foundation for the equitable adult use cannabis market in New York State. During this special CROPtober edition of our program, we're going to delve into all these details with two really remarkable guests today. First, I'd like to introduce Dr. June Chin, 9 months on the job, and she is the Chief Medical Officer at the New York State Office of Cannabis Management. She is also a longtime medical practitioner and advocate. So Dr. Chin, welcome. We're excited to have you. I also want to have a shout out to my good friend, Felicia Reed, the Executive Director of the Office of Cannabis Management. And back by popular demand, I'm also pleased to bring back Dr. Kenneth Weinberg back to the program. He is the founder and Chief Medical Officer at Cannabis Doctors of New York, a Northwell Medicinal Cannabis Work Group member, dementia advisor to Caring Kind, and Canformatics, blogger for Psychology Today, published author of Exquisite Moments of Sorrow and Grace, and an advocate for single-payer healthcare and medical cannabis. Dr. Weinberg, welcome back.
Thank you so much. My pleasure to join both of you.
You know, it's amazing. We do we were talking prior to, we do a lot of shows on a lot of topics. And the popularity of this one when we did it before was really off the charts. So we're really excited to have you both back. Dr. Chin, let's start with you. It's CROPtober. Again, I had never heard that prior to hearing it. I love the name, but as we mentioned at the top, this refers to this season of outdoor cannabis crops when they can be harvested, dried, and processed. We're going to be talking a lot about medical cannabis today. So tell us what's legal and what's not when it comes to growing your own cannabis, whether it's for medical purposes or recreational purposes.
Yeah, I'm super excited that it is CROPtober. I mean, this is that golden time of year when New York's outdoor cannabis plants reach maturity and they are carefully harvested, they're dried and prepared for use. So under our state law, adults 21 and older can grow up to 6 plants, 3 mature, 3 immature in their private residence for personal use. Medical patients or their certified caregivers can do the same. And the key is keeping it secure, making sure that it's out of public view, and you can share it with a caregiver, but you cannot sell or barter.
And for somebody that may be interested in going down this road, how do you learn how to do it? And, you know, are there workshops available? Are there videos? How does somebody begin the process?
Growing cannabis is learnable. Think of it like indoor gardening, simple to start, with a learning curve if you want high yields or medical grade flower. But across New York, there are community programs, cooperative extensions, even online tutorials that will walk you through safe, small scale home cultivation. So you don't have to be a botanist. You start with a single plant, just one or two plants, just like you would with a tomato or a basil pot.
Which I cannot grow any of those in my house for some reason. Dr. Weinberg, any tips that you would have for growing cannabis? Is it easy? Is it easy to learn? What are the benefits of doing the homegrown approach?
Well, maybe I shouldn't, but I'll make a confession that I've been trying to grow it for the last 50 years at various times and places in my life. And recently I had one good crop. I think it's pretty. I think really sunlight and good soil is the thing. It's a weed. It grows. It will grow extensively under the right conditions. I don't think it's that hard to grow.
So folks can certainly look for that. Can you guys go through how is recreational cannabis and that program different from the medical program in New York State that was established?
Yeah, June, I think you're the best one to really clarify the distinctions.
Sure. So recreational or adult use cannabis is for general enjoyment and wellness. You can buy it legally from licensed dispensaries, but you're largely self-guided. The medical program is different. It's clinically overseen. Patients meet with a certified healthcare provider who will review your medical history, your current medications, your treatment goals. Products are manufactured, high standard, tested for purity, and tracked for safety.
And the other thing, which I think has to be talked about a lot, is New York State is one of the few places where when you are a medical patient, before you get started or before you actually obtain product, you have to talk to a pharmacist. And these are pharmacists who've been trained extensively. I've had just fabulous experiences with the pharmacists at the various registered organizations. And I really applaud New York State for making that a requirement.
Yeah, we talked a lot about that on the last show and want to reiterate that as we go through today. There is a difference between recreational and medical use. And, later in the show, we're going to talk about what the benefits are from your guys' perspective. You've seen it, you've lived it, this is what you do. And starting with a medical professional is really, really important. But before we get to that, is medical cannabis covered by insurance in New York State?
Now, this is important, especially for our Medicare patients, our seniors on fixed incomes. The medical cannabis itself is not covered by insurance. However, the care can be provided by insurance, and you don't need to pay out of pocket for medical cannabis certifications or consultants. This visit should be part of continuity of care, the same way you see your primary doctor for diabetes or pain management. The conversation about medical cannabis belongs in your doctor's offices, covered under your existing care, not a separate cash-only clinic. If your doctor is not yet comfortable with cannabis, it's okay. Ask them to learn. And I do want to stress that. And according to a recent 2025 JAMA Network consensus statement, doctors in the U.S. agreed on key things that every doctor should learn about medical cannabis. So the issue isn't that many patients aren't interested. It's that doctors were never taught about cannabis in medical school. But when patients start bringing these questions to their Medicare covered visits, you'll create a ripple effect. Doctors will see that there is more and more demand. Doctors will begin to study it. Institutions will begin to train, and policy will catch up as well.
And can I just add to that? I make it very clear when I'm seeing patients as a consultant that I really want to and try as often as possible to work with their primary care doctors. I mean, I think educating our colleagues is very important, and collaboration with them is very important as well. So I just wanted to stress that.
And when you go to the medical dispensary, seniors, ask for a Medicare discount, ask for a senior discount. A lot of the dispensaries will have special discounts for seniors.
Yeah, and I don't want to bring up something to make me sound ageist, but I think, if you're an older doctor, certainly the way that cannabis was classified, right, in the 50s and 60s, is way different than what we think about it today. So, not only can people learn more about it, certainly physicians can, and I'm assuming the younger group of physicians going through the residencies, et cetera, probably have a different view at this point. So let me ask you, because you guys are both doctors, right? And one of the things I'm always really interested in are what the positive benefits are to people that might have, chronic conditions, for example, have difficulty sleeping, anxiety, pain management. Can you guys walk us through what some of the benefits are to considering cannabis for your overall health and wellness?
I will just throw something at the beginning that I've come to understand that almost everybody, I think, who's using cannabis is using it for health benefits, to feel better, whether it's just an overall sense of helping with anxiety or mood, or all of the things that Dr. Chin and I could talk about that we have seen over many years, the specific benefits for particular conditions. And I'll let June talk more about that, but and I will join in. But I've come to understand that I think that's really why people find themselves using cannabis.
Exactly. I would say the three conditions that patients come in asking about medical cannabis to complement, what perhaps some of the medications they're already taking is sleep disruption or insomnia, anxiety, and chronic pain.
So what are because chronic conditions are going to cost the United States $800 billion by 2040, and there's a lot of them, right? We could name them. Given that the population that we reach out to and see the most are older adults, what other types, just so if this triggers something in somebody's mind who's listening to this today or later, that this may be beneficial for me to raise with my doctor, go into a little bit more specificity on some other conditions where this may be beneficial, so long as you start with, whether it be the pharmacist or you're talking to a doctor.
Yeah, well, I'm certainly seeing a lot of patients with cognitive issues. Very, very prevalent condition as we age. And it has been extremely helpful. And I can talk more about that later. I know we may get into that later on. But certainly any of the inflammatory conditions that go on in all of our different body systems, as we age, inflammation becomes more and more of an issue. And so it'll affect the cardiovascular system, the GI system, the pulmonary system, the skin. And I'm just seeing people with autoimmune disease, helps with problems with cancer. I'm seeing a lot of patients who lose their appetite, who develop neuropathy after chemotherapy, where it can be very helpful. Those are just a few, and I'm sure that June can throw in many more.
I would say the biggest is arthritic issues, rheumatoid arthritis or general arthritis, where there is an inflammatory condition. And patients say, well, the medications that I've been on for the past couple of decades are just not hitting it, are just not helping. And sometimes adding medical cannabis carefully really helps decrease the inflammation, increase mobility, allows the patient to be a little bit more independent in their daily activities. And this is sometimes simple things as cooking or walking the dog or gardening. Patients will feel that they have a little bit more mobility and better quality of life.
Is there a recommendation from either of you? And the answer may be it's really individualized. Is there health impact, either positive or negative, to smoking versus vaping versus edibles?
I certainly discourage smoking, from the get-go. So, I think ingesting it in other ways is much, much better.
Agreed. Of course, if you're smoking, if you're, combusting plant material, it is going to irritate the lung mucosa, especially as we go into the colder season, the flu and cold season, where we already have increase in coughing and bronchitis and pneumonia. You just don't want to add combustible plant material and irritate your mucosa. There are plenty of other options like sprays, powders that you can put into your beverages, edibles in the form of gummies or capsules or tinctures that that will offset the risks of smoking.
Yeah, okay. Thank you for that. Dr. Chen, OCM has a medical cannabis program. What are you guys doing to provide outreach to patients, practitioner communities about your program?
Well, in November, we are partnering with Northwell Health, thanks to Dr. Ken Weinberg, to host the state's second medical cannabis symposium. So we're bringing together researchers, clinicians, policymakers to give providers the tools they need, right? We talked about education in the beginning. More physicians, more health providers really need to guide patients safely and responsibly. So this symposium is designed to give providers practical tools, how to evaluate patients in real world scenarios and tailor treatment plans. We invest heavily in education. We have a cannabis education library. So if you go to our website, it offers more than 35 free printable resources, multiple languages. So from what's legal to safe use to special population guidance, because legalization isn't just about access. It's really about taking a health first approach. And that's what we do at OCM.
Yeah, and I think you guys both mentioned how proud you are of New York at the way that they've approached implementing this. So if somebody wants to, whether it be an adult or a caregiver, wants to get certified for medical cannabis, can you walk through what those steps would entail?
Well, bring it up to your next visit. Say, doctor, I've been hearing about medical cannabis. Can we talk about whether it might help my pain or sleep? Have an honest review of all your medical conditions and medications. And if it's appropriate, your provider will certify you or a caregiver to help you obtain the medical cannabis. And then you can shop safely at a licensed dispensary. There are staff pharmacists where they can explain dosing. But your health provider should really remain part of your follow-up care. And then check back regularly, tracking how it works, reporting any changes. For example, and then keep your loved ones, updated. If you're living alone, for example, and you want to try medical cannabis, you want to make sure that someone is home, for your first few doses, making sure that you're familiar, just like you would if you took a new medication or a friend, and just to have safety precautions.
And I will say the Office of Cannabis Management website has a link so people can find, based on the county they live in, practitioners who are registered with the state. And I will also add that a lot of the patients I'm seeing are referred by their family or caregivers who say, maybe you should think about using cannabis for the X, Y, or Z issue. That comes up a lot.
What are you guys seeing as far as, because we talked about this last year, right? The same population that went through. Unknown caller. Sorry, that's my bad. Went through, again, the 40s and 50s and the classification of the drug, who are now the ones who we're talking about potentially the benefits of. Talk a little bit about, are folks coming in with stigma, or are they doing enough research and understanding the benefits? Just talk a little bit about that if you could, based on your experience.
I will just say one thing, and I'm sure that June would agree. So many, especially of the elderly patients, will come to me after using so many other meds, none of which really get them the help that they need. But the first thing they'll say to me is, okay, you know what? I'm ready to try medical cannabis, but I don't want to get high. And, which I can easily reassure them they won't. But I'm sure that June has had many similar conversations like that. That's really what that stigma is still there in a way, the reefer madness stigma. But yeah. I think as people get older, and there's so many of the medicines that people use have so many side effects and interactions, et cetera. And the way I always think about this is we make our own cannabis. It's inside of us. We have cannabis. We have a whole endocannabinoid system where we make cannabis that looks very similar to what the plant makes. So I think it's ultimately much safer in so many ways than any kind of synthetic chemicals that we're taking into our bodies.
Yeah. Dr. Chen, the legislation that really created the whole market and process in New York, I understand there's some amendments to that. Can you walk through what those are and what changes are being proposed?
We are super excited. We're waiting for the governor to sign Senate Bill 3294, which is a major update modernizing our medical cannabis statute. And it really designed to simplify and expand patient access. So what does this mean for seniors and Medicare patients? Less frequent renewals. So we'll have 2-year certifications, and that reduces the hassle for older adults managing multiple appointments and paperwork. More flexibility in cultivation. Younger adults, 18 and over, are included in expanding this access. And then we have cross-border access. And what that means is a reciprocity. So that helps patients who move or travel. Perhaps they're in New Jersey and they come into New York for work, or they're Connecticut or up and down the Northeast corridor. So they don't lose coverage away from home. So if you have a medical cannabis card, a certification in another state, you can come and shop in New York. We're educating other clinicians really so they can talk openly about cannabis without stigma and fear. And at the same time, we're expanding caregiver models. We approved 9 new registered organizations, and these are organizations that produce the medical cannabis. So by approving 9 new ROs is what they're called, each of them are eligible to open up to 8 more medical dispensaries. So this ensures patients are never left without critical care or formulations.
Oh, that's great. That's great. We're going to take a quick break. We'll be right back after this break, but make sure you subscribe to our YouTube channel today, and you'll never miss any of the live streams. We have a ton of content on there. You should also check out What's Cooking with Nysofa. There are more than 50 episodes, and you'll discover how easy it is to create nutritious and delicious meals that won't break the bank. Take a look at this.
What's Cooking with Nysofa? A new cooking show from the New York State Office for the Aging and SNAP-Ed New York. Each month, registered dietitian Wendy Beckman demonstrates exciting recipes that are quick and easy to prepare and won't break the bank. New episodes premiere on the last Friday of every month at 12:30 p.m. Save time, save money, and eat healthy. What's Cooking with Nysofa? Streaming on Nysofa's Facebook and YouTube channels.
Now, those are not stock footage. That's real meals from What's Cooking with Nysofa. Dr. Weinberg, let's go back to you. We've heard from Dr. Chin about the administrative process for certifying as medical cannabis patient. Tell us what this looks like from the practitioner's perspective. How can a physician help the patient navigate the certification process? And what does the cannabis practitioner actually do?
Right. So when someone comes to me, I will sit and talk with them for between 45 minutes and an hour and really just tell them as much as possible about the program, about cannabis, about the pros and cons, about how we will really be approaching their medical condition. And then I will set up an appointment with a pharmacist at one of the ROs, one of the dispensaries, and we will then have a consult together, the 3 of us, where we can really, because each of the ROs have different products, and I want to make sure that the patients are getting the best products from that particular dispensary. And we'll have a long conversation about that, make sure that they get started. And then I do follow-ups as frequently as possible, because even in the first week or 2, there's going to be questions. They may have reactions. Somebody may take a little bit too much, and we have to say, no, it's okay. You know, your body's going to get used to it. But I really try to follow them as closely as possible, especially at the beginning. I also tell them to take notes. I want to know every time you take a product, what are the things that are happening, so that you'll know that the next time you use that product, you're going to have the same kind of response.
So delve into that point a little bit deeper, because we're all interested in helping, but safety is critically important, which is why these things have been set up the way that they have. So in your oversight role as a physician, you kind of walk through some of the things that you're looking for. I love the idea of taking notes. You know, because you're based in a certain geography, New York State's a big place. Is the oversight or the evaluation to make sure of the safety aspect, is that done in person? Is it done over the phone? You know, just again, based on your experience, how does that happen?
Yeah, it really varies. I've been doing a lot of telemedicine ever since COVID happened. So there's a distant kind of evaluation or supervision I'm doing. But a lot of the patients, especially the elderly, live with other people. They have people that are with them. So I'm talking with them. And a large proportion of the patients I'm seeing are in adult living facilities. So I'm constantly talking with the nurses in addition to the families. And I get very frequent follow-up in those settings, especially.
That's great. Let's talk a little bit about impact as our bodies age. Big difference between a 20-year-old and me who's 57 or somebody who's 87. So how does cannabis use change as our bodies age, or what should we be thinking about?
I'm happy to jump on it, and June, please, jump in. But I think, we have two main cannabinoid products that we make, and their levels seem to change and possibly go down as we age. The amount of receptors in different parts of the body seem to change as we age, and especially since I'm working a lot with dementia. The hippocampus in the brain has a lot to do with memory. It seems like that gets affected a lot by aging and doesn't work as well, doesn't have as many receptors. And I think that's why I'm seeing such really, and again, we can talk about this later, remarkable benefits in people, in my dementia patients, where people who had never been verbal will start talking again. So it's certainly happening there. Again, because the endocannabinoid system is in every system of the body, it really is affecting, especially as June mentioned, the inflammation that goes on in cardiovascular tree, in the pulmonary system, and I think that's one of the reasons that people do so well as we age, because I think we don't have as much on board, and we can bump up and get back closer to a normal level when we are using cannabis.
And I would say, think about the last time you've been to someone's home who's elderly. I think of my parents, my mom, who's in her 80s. I mean, there's 6, 7 pill bottles, even if you use the ones that are, have one in each day of the week, they're full, right? You have the supplements and you have all the medications. So when we often see patients, elderly patients, they have pain pills, sleep aids, anti-anxiety medications, appetite medications, anti-constipation, right? And sometimes these medications will interact. They can cause grogginess. They can be the cause of elderly falls. So sometimes when we bring in an anti-inflammatory, a natural anti-inflammatory like cannabis medicine, it can provide the pain relief. It can help with sleep. It can help with ease anxiety. Now, I'm not saying it's a magic pill, but oftentimes you can eliminate 2 to 3, 4 sometimes prescription medications safely with doctor oversight if you're integrating medical cannabis.
Yeah, and some of those you just mentioned are risk factors for dementia. So there's a lot of different benefits. And you're right. I started as a case manager, and the first thing you would do in somebody's home is look at the medications, and there would be trays and trays of meds. It's extraordinarily dangerous. One of the things that I love about this show, not only the content and the great people that we have, but it's seen by people of all ages. And we have 4.1 million people like me who are caring for somebody else. Not all of them are older adults, but certainly a large percentage of them are. How would you suggest, if the older individual could benefit, but maybe reluctant from one way or the other, or reaching out or doesn't know how to do that, to get somebody like me who is a caregiver for, a parent, to raise the issue not only with the individual, but maybe potentially their physician?
Yeah, I mean, I think it's education. I mean, that's why June alluded to the symposium we're doing next month. We hope that we're going to get out to as many people as possible who really begin to understand the benefits that we're seeing and that the plant provides. And I'll just mention one other thing, which was crazy, but 2 weeks ago, Trump on Truth Social actually posted something about the endocannabinoid system and aging in a very positive way. I don't know what's going to come of it, but it was extraordinary that he did that.
I think the best way for caregivers to start the conversation is with curiosity and not quite persuasion yet. So instead of saying you should try cannabis, you might want to try and say something like, well, I read medical cannabis can help with pain and sleep in older adults. What do you think about talking to your doctor about it? That way, that question keeps the focus on safety and partnership and not pressure, just in case there is still some stigma or some misinformation about what cannabis can or cannot do. And I think caregivers can help by making it less overwhelming for their loved one by gathering reliable information. So bringing printed resources from our OCM website, or maybe studies from trusted sources, not Dr. Google, right? So that your loved one feels this is real medicine and not just guesswork. Because sometimes that's where the hesitation is as well. And to really remember and remind them that they don't have to navigate this alone. It is overwhelming to get to the doctor's office, even to set up a telehealth, for example, right? You want to make sure that you loop in your loved one's regular doctor to guide through the process. And these conversations, again, can happen during your Medicare covered visits. So I do encourage you to bring this up with your provider or your specialist. And then I would say the final thing is just, most importantly, is just listen. I think older adults really just need reassurance that this is safe, this is legal, this can be part of their care and not something to hide.
Yeah, and I think print education material is great. I'm going to answer the question a little bit different way. I would say for anybody who's caring for somebody who could potentially benefit, you could simply say, let's watch Live with Greg. There's these two amazing doctors, Dr. Chin and Dr. Weinberg, who, can walk us through all of this. Because I think there's a big difference in hearing from you two who really care, have experience in this, talked about the safety of it, versus a written pamphlet. So that's going to be my recommendation: is spend 45 minutes and watch this show, and then you can go from there. Let's talk again, because safety is really important to me as it is to you. What are side effects, maybe some common side effects, and how can people minimize them if they experience them?
Yeah, I mean, dizziness, lack of balance can happen. Anxiety can occur. We know that the heart rate can go up initially. Blood pressure could go up. All these things are transient, though. And again, June knows this so well, the recommendation always is to start low and go slow, especially with the elderly. I mean, people can be exquisitely sensitive to cannabis, and we're starting at very, very low doses and letting people build up over days or more.
Yeah, and I think what you talked about in terms of, if somebody is starting, how critical both of yours or another practitioner's evaluation is, so that if there is those types of side effects, just like any other medication, right, you can make adjustments that are going to hopefully minimize or mitigate them altogether.
Exactly. And just to add to that, when you go into the medical dispensary, because there's a pharmacist there to guide you, just like you would if you picked up your prescription at CVS or Walgreens or Duane Reade, that pharmacist will go through your medication list one more time, even though your provider might have, but also natural supplements. Maybe you're using melatonin or valerian root, or maybe you're using a supplement that you didn't know might interact with it. So that pharmacist is key in our medical dispensaries, and that adds as a safety guard as well.
Yeah, and these, no pun intended, but the dispensaries are cropping up all over the place. Before we head into the next break, I'll ask you both one final question. What do you see as the most exciting trend, opportunity, or policy change for individuals considering medical cannabis?
Certainly in my practice, the patients I'm seeing with autism and with dementia have just been really gratifying and exciting and also provocative. In fact, at this conference symposium we're doing next month, we have some experts who are going to be talking about what goes on in the brain, why the changes that I'm seeing in June as well with kids with autism and the patients with dementia. Why is that happening? So that to me is the most exciting in what I'm seeing.
And we're starting to see real integration. I think physicians and other health providers discussing cannabis alongside blood pressure medications. Again, pharmacists reviewing it on medication lists. So there's a cultural shift that's happening. And I would say from the policy perspective, the momentum is towards affordability and equity, making sure that we continue to help lower costs, expand access, and ensure that older adults on Medicare are not left behind. I mean, the exciting part is not just legalization, it's normalization. I think when cannabis becomes, another tool for living well and aging comfortably, staying engaged in your own care.
Yeah, I totally agree. So we're going to take another break, and then we're going to get to some audience questions. But it's that time of year, folks. Open enrollment period for Medicare is going to begin on October 15th. Here's our own Heather Leddick, who does an amazing job. Her entire team, our 59 county health information counseling assistance programs, and several other partners that we have that help put money back in your pocket, but most importantly, get you the Medicare Advantage plans, prescriptions, and other interventions that you need to stay healthy and safe. So let's check out Heather.
This is Greg Olson, and I'm the director of the New York State Office for Aging.
Hi, I'm Heather Leddick, and I'm with New York State Office for the Aging with the HICAP program.
So right now is open enrollment time, but you can't turn on your TV without somebody trying to sell you one of their products.
So someone might ask, what's the right plan? How do I know what decision to make? And the best thing to do is reach out to HICAP, the Health Insurance Information Counseling and Assistance Program. And you can reach us by calling 1-800-701-0501.
All of our counselors in New York State are state certified and highly trained. They're not selling you anything. What they're providing is information so that you can select the best plan that's right for you.
There's 15 prescription drug plans available for Medicare beneficiaries in New York State for 2024. There's 280 companies offering Medicare Advantage plan. Last year, HICAP counselors helped Medicare beneficiaries save $115 million through prescription drug savings and other Medicare-related health costs. Medicare can be very complex, so we encourage you, if you have questions, to please call HICAP today, 1-800-701-0501.
How is anybody expected to understand 280 insurance products and 15 prescription drug plans? Please call HICAP today. It could be the best call you make this year.
Don't call the number on TV. Call this number.
A product. We're selling information, objectivity, and choice for the best decision that you can make. So let's get into, I know there's going to be questions from the audience, so let's start with those, and either of you or both of you can answer. How do I know if a dispensary is legitimate and licensed dispensary?
Oh, I love that question. I get asked that question on a daily basis. You want to make sure the store is legitimate. You look for the dispensary verification tool that's posted in the storefront window. You scan that QR code. It takes you straight to our website, New York State Office of Cannabis Management's page showing all the licensed medical dispensaries. So if the store does not have a sign or scanning does not confirm it, do not buy there. You can also double check anytime at cannabis.ny.gov.
All right. Cor, thanks for the question. It's rather expensive overall, and I need to learn about growing. Where do I get seeds?
Do you know, June? I don't.
I don't know about seeds.
Alex, do you know?
Because seeds are illegal, right? I mean, you can get them online illegally, but I think actual seeds are not still considered legal.
So, Cor, we will follow up with that question. It's rare that none of the three of us can answer, but there's a first for everything. So when we'll post that question and make sure we have an answer for you. Should I be concerned about any interactions from other medications I'm on?
Yes, I mean, that's why you talk to us. Absolutely. We always will look at the list of all the meds somebody is on and go through them and look for any potential interactions. And again, like June said, and then there's the follow-up with the pharmacist also, who is going to be looking at them as well. So
Exactly. You want to make sure blood thinners, for example, cardiac medications, if you're on other medications for sleep disruption and insomnia, they can amplify each other. So you really want to be careful. And then you want to be careful with alcohol. If you are consuming alcohol, the cannabis can decrease your tolerance for alcohol. So you do want to make sure that you are careful.
Good advice. Do we have another one? How can older adults find a qualified medical cannabis practitioner in New York?
Yeah, on our website.
Yeah. How do they find folks like you?
No, the website has a list, as I said, for county by county of all of the registered cannabis practitioners in the state.
There it is right there, cannabis.ny.gov. Let's see if we have another. And I think that's it for the questions. So again, I just want to thank Dr. June Chin, Chief Medical Officer at the Office of Cannabis Management, Dr. Weinberg, who's the Chief Medical Officer at Cannabis Doctors of New York. This is super fun. It's very informative. It's extraordinarily important that there's other options beside pharmaceuticals, which people often don't know are never tested on older adults to begin with. And here's an opportunity to really make a positive impact on your overall health and wellness through something that has been studied, tested, is regulated the right way here in New York State. I'm going to do one more shout out to, go ahead.
I have an answer to the seed question.
Oh, perfect.
So some medical cannabis dispensaries carry them, but not all. So patients should call the dispensary first to confirm if they're available. So you want to make sure that you're using the right seeds that will grow the right THC to CBD ratio that you need, for example. So not too strong. Maybe you need something a little milder, and the medical cannabis dispensary can help you.
Excellent. I want to thank the Office of Cannabis Management staff for watching this today and getting us that answer before we got off the air. So again, I want to thank both of you guys. Our next show, we talk about how important volunteers are in the state of New York, especially older adults. We have almost 1 million volunteers providing 482 million hours of service at an economic value of $13.2 billion. Did you know we have 33,700 not-for-profits in New York State that would not be running operationally, not only without older volunteers, but volunteers in general? As always, I want to thank our communications team that makes this production incredible, Alex, Darren, Roger, and we'll see you in a couple weeks. Thanks so much. Be safe, everybody.
Thank you.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please join us next time.